Question for you. Have you ever had a medical doctor, a physical therapist, a chiropractor, or a personal trainer tell you to rest, stretch, and ice your nagging injury or nagging area of discomfort, and then follow those orders only to feel like it goes away a little bit, but right when you go back to your activity, it's right back again with a vengeance? That drives me nuts. I'm really tired of clinicians who are giving that type of advice to people that are just trying to find a good way to finally get better and be stronger and be better versions of themselves, when we know that rest, ice, and stretch does not give lasting results. So what I want to do is I want us to come together and get on the same page as clinicians, get on the same page with our customers, our clients, our members, our patients, and all of us get together on the same page with what we know. We know that the best way to address especially tendinopathy-based, tendon-based overuse and chronic inflammatory discomfort of that nature, the best way to address that is through working through it and strengthening those tissues. And that goes for muscle, that goes for ligament, it goes for bone even. We can't keep telling people to shut it down, rest, see if it goes away, cross our fingers, and then we'll see what happens. Maybe you go back to your activity, maybe not. Let me know if it goes away. That's frustrating for the people on the other side of that, because you then set them into this process of, okay, the answer to getting better is stopping activity, resting, icing, stretching, and then I'll try it again. I'll try my activity again. I'll try to go back to what I love to do. And then all of a sudden, there's been no preparation for those tissues to go do their 3 times a week run, or to go do their hockey league, or go do whatever it is that they're trying to get back to. It's not preparing them to do that. And what we do know is that working and strengthening those tissues will create nourishment and durability in those tissues. So I want us as clinicians, I want us as the audiences that we're working with, I want us all to be kind of getting together and saying, look, as clinicians, there's 3 steps, in my opinion, to how we should be helping people to solve their nagging injury and discomfort issues. Number 1, you've got to do an assessment. So if you're a clinician and you're not doing an assessment of some sort with your clients, with the people that you're working with, then you're just throwing stuff at the wall. And if you're a patient and a client of somebody of a clinician or personal trainer, somebody that you're working with who's not doing an assessment or never did an assessment on you, I suggest you look elsewhere. So number 1, assessment. We have to assess how the body's moving, what things are working well, what things need to be worked on and improved. Number 2, we have to think about, as clinicians, giving people the power to work through these issues. We cannot continue to tell people to shut it down. Shutting it down sets us back in the process of getting better, of getting stronger, of getting through this issue. And so we have to work through these issues and teach people that these are the things that you can do. Don't rattle off all the things I don't want you to do, and don't do this and don't do that and stop doing this, and then, you know what, just go home, don't do anything for 2 weeks, and then call me and tell me if it's better. Of course it's going to feel a little bit better. I mean, you just shut everything down, but then when you go back to certain activities, there's no way those tissues are prepared to go back to those activities. So we're really setting people back with that. As a person on the other side of that advice, you should be listening for people that tell you and empower you to go do work and work through. Even if you're working around an area that needs some time away from some physical stress, that work that you could be doing with your lower body, if you've got an upper body issue, can be indirectly triggering a response within your body that is the response that we need, which is to get you stronger and better and feeling like you're able to tolerate activity. Number 3, we need to set expectations. So appropriate expectations are for something that's taken a while probably to develop, are that this is going to take a while to unravel at times. It's going to be a slow build. We're not going to change this with one magical treatment effort that in one session all of a sudden everything is better and it's going to stay better forever just from that. That doesn't exist. You may get a 1 to 2 treatment response that makes you feel a little bit better after this, but in terms of baking in lasting results and getting rid of this nagging injury issue, that's not going to happen in 1 to 2 treatments. I don't care what you're doing. So building up and helping to form really clear and realistic expectations that this is going to be a long game approach. It's going to take a little time, 4, 6, maybe 8 weeks to see some level of lasting response and result. And then in addition to that, the other side of the expectations that we need to help people to get accustomed to who are going through this frustrating nagging injury issue is they need to be let off the hook or made to be okay with the fact that what we're going to challenge you with as clinicians are some things that might, what I call, stir up the mud at the bottom of the pond. So if we're doing some things that are challenging and your nagging injury area is kind of talking back to us a little bit in a tolerable but present way, that's okay. And that's typically necessary to get those scales to tip from nagging to then all of a sudden we're stronger and less intensity of nagging and strength is building and that sort of frustrating nagging discomfort is starting to go down. So what I want to do is I want us to use those 3 steps: assess, I want to work our way through these things in a responsible way, and I want to really set expectations the right way in this process. I think we can all enjoy this process a lot more of really unraveling and untangling a frustrating nagging injury issue, getting it back on track, getting people back to their activities that they love to do, that they deserve to be able to do, and not setting people up for this vicious cycle of feeling like they're fragile, like if they move and they trigger something, that it's going to create a cascade of setting them back to square one, and that the best way to avoid that is to stop doing things, and this big long list that just keeps growing of things that they should stop doing. That's no good for anybody. Let's work through this together, and as clinicians, whether you're an MD, a PT, a chiro, a personal trainer, if we're all on that same page and empowering people to go through that in that way, this is going to be a much more fruitful process for us all. So that's what I'm looking for. I think everybody on the other side of that advice who is looking to solve their nagging injury issues would agree with me on that. Let's get on the same page. Let's get these nagging injuries solved in a fun and together way, and we'll together be able to have this process not be a frustrating bang your head against the wall, stop activities type of thing.